it's me again, your student nurse for today, Camila Saliego. And now, I will show you how to give or to administer an oral medication. But first, let us know what is medication. Medication is a substance administered for the diagnosis, cure, treatment, or a relief of symptom or for the prevention of diseases. Oral medication administration is the most common, least expensive, and most convenient route. In giving the medication, you need to know the 10 rights of it in giving medication. First, the right medication. Second, the right dose, the right time, the right route, the right client education, the right documentation, the right to refuse, the right assessment, and the right evaluation. The purpose for administering medication is to provide a medication that has systematic effect in the gastrointestinal tract. Now, let us go in doing the administration of medication. First, perform hand hygiene and observe the appropriate infection control procedures. This is to prevent cross-contamination. Then, unlock the dispensing system. This is to check the medication. Next, read the medication order and take the appropriate medication from the shelf, drawer, or refrigerator. This is to ensure that we have the right medication. Compare the label of the medication container against the written order. This is a safely check to ensure that the right medication is given. Next, check the expiration date of the medication. Outdated medications are not safe to be given or to be administered. Next, you need to prepare the correct amount of medication for the required dose without contaminating the medication. This is to ensure that the right dose of the medication is given. Let us go now for the tablets or capsules. First, you need to place package unit dose, capsules, or tablets directly into the medicine cap. Do not remove the medication from the package until the bedside. Next, if using a stock container, pour the required number into the bottle cap and then transfer the medication to the disposable cap and without touching the tablets. Then, if the client has difficulty swallowing, you need to crush the medication or the tablet to a fine powder with a pill crusher. This is because the wrapper keeps the medication clean. Not removing the medication facilitates identification of the medication. In the event the client refuses the drug or assessment data indicates to hold the medication. An open unit dose packages can usually be returned to the medication cart. Now, let us go in administering the liquid medication. Mix the medication before pouring and put the cap upside down on the countertop. This is to prevent contaminating the inside of the cap. Next, place the medication cup at a flat surface at eye level. This is to ensure the accuracy of measurement. Next, hold the bottle so the label is next to your palm and pour the medication away from the label. This is to prevent the label to becoming soiled and illegible. Before capping the medication, wipe the lip with a paper towel. This is to prevent the cap from sticking. For sublingual medication, instruct the patient to put the medication under the tongue and allow it to dissolve completely. The rationale for this is for the drug to produce desired therapeutic effect. Next is for the buccal medication. Instruct the patient to put the medication inside the mouth and against the cheek and allow it to dissolve completely. The rationale for this is to make the drug produces desired therapeutic effects. Then, you need to provide client privacy. This is to protect the client's integrity. Then, check the client's identification band. This is to ensure that the right client receives the right medication. Then, you need to assist the patient to a sitting position or, if not possible, to a side-lying position. These positions facilitate swallowing and prevents aspirations. Then, you need to explain the purpose of the medication and how it will help the patient. This is because information can facilitate acceptance and compliance with the therapy. Always remember to administer the medication at the correct time. Give the client sufficient water to swallow the medication. This is fluid, ease swallowing, and facilitate absorption from the GI tract. Then, use the pill cup to introduce the medication into the client's mouth and give only one tablet or capsule at a time. This is putting the cup to the client's mouth maintains the cleanliness of the nurse's hands. Giving one medication at a time eases swallowing. Now, let's move on and administering medicine through the nasogastric tube. You need to crush the tablet or open capsules and dissolve powder with 2 to 30 milliliters of warm water in a cup. This is to help the body absorb the medication faster. After doing the medications or giving or administering the medications, you need to record the medications given, dosage, the time, any complaints or assessments of the client, and your signature. This is for documentation purposes. Then lastly, you need to dispose all of the soiled supplies appropriately and wash hands. This is to replenish stock and return the cart to the appropriate place.